So we continue our conversation with Will Hild, who is the Executive Director of Consumer Research, talking about a particular medical unit, a big one, hospital system, and really huge here in Michigan, and some of their problems, many problems with wokeness. So, Will, we were talking going into the break about the issue of this trans ideology, which was something that was very important to the late Pope, and he mentioned this in several documents, how this is really the attack on the human person in so many ways. It's amazing to me, though, that not just hospital systems, but as I was mentioning before the break, so many other entities around the country, even though regardless of where people stand politically, this is shown to be a losing issue. Why are they hanging on to this so tightly, do you think?
That's a great question. One area is a specific lobbying institution called the Human Rights Council, which has been the tip of the spear in the LGBTQ activism community, especially when it comes to corporate America or large organizations like Fort Health. And they have honed their skills, attacking organizations who don't go along with whatever the newest LGBTQ issue is. And because this is sort of the forefront right now for that. I think that's why you've seen corporate America and these big health systems like Fort Health, allow it to get entrenched, and two, not get rid of it when it's such an obvious offensive thing. And frankly, a lot of states have banned it now. I don't think Michigan is unfortunately one of them, but it's increasingly been a criminal issue. So you're right to be somewhat astonished that they haven't abandoned something that's just so clearly ridiculous and too harmful and three, illegal. But unfortunately, this is not a problem that's going to take care of itself. We're going to have to chisel these people out of this. And I agree with the late Pope Francis that this is truly demonic. And that's one of the reasons we want to raise this issue, is because when people go in to get a treatment, to get an X-ray, to get an arm set, whatever, they don't want to think that down the hall they're performing, Dr. Mengele experiments on kids. But this kind of nonsense is exactly what's going on.
It is amazing. And then you see in countries that are considered much more even, far left than the United States of America in many areas, such as Great Britain, putting a halt on the puberty blockers and, other things related to these so-called transitioning surgeries. And yet here we go. The United States seems to still keep moving forward with it, even though there are many states, as you said, thanks be to God, that are banning it. Where do you think this is going to go? Do you think it's going to slow down?
I think the fight is going to heat up, but ultimately we are going to win. One of the nice things we have now with the current Trump administration is a focus on ending this kind of thing. One of the reasons we're highlighting this is both for the state of Michigan itself, which probably subsidizes Fort Health in a number of different ways, but also the federal government sends tons and tons of money to these health systems for, experiments and services and, research and all that kind of